Hi, everyone. It's wonderful to be here with you today. And I think we have a really, really amazing panel with us. I'm going to, of course, want to thank Bene Studio for asking me to host this panel. But I can't tell you that it's not probably a better time in our life today to talk about accelerating digital transformation in healthcare. And while all of us are, of course, impacted by the severity of COVID-19, I think I can't imagine a better time to really talk about our obligation to really transform this industry together. And as I said, disruption is not a choice. Now it's really an obligation. So really, really happy to be here and have that incredible conversation. I want to give a warm welcome to our amazing panel. And so I'll let them introduce themselves. I'll start by Laura Barrera. Very nice to have you with us today. Please introduce yourself.
Hi, everyone. Can you guys hear me? Okay.
Yes. It's all great.
Okay, great. So my name is Laura Barrera. I'm a manager at ECG Management Consultants. We're a management consulting firm that focuses exclusively on healthcare. We've been around for about 40 years, and I work in strategy and performance transformation. I'm based out of Southern California. And at ECG, I focus on patient access, clinical operations optimization, digital health. I work primarily with provider side, but we also do work with non-traditional providers and startups. And I'm a black belt in Lean Six Sigma. I'm also trained in design thinking, so I like to use the learnings that I have in both of those backgrounds to really help clients with their challenges in eliminating waste, implementing best practices, and coming up with new innovative solutions that provide better patient-centric care. What else? Before my time at ECG, I was at Kaiser Permanente, and there I wore a couple of hats. So I oversaw patient access. I was also an improvement advisor and an innovation catalyst. And just as a fun side note here, I am also a co-founder of a social impact startup. So a few weeks ago, my team and I were one of the winning teams at the MIT COVID-19 versus Latin America hackathon. So we're currently working on that product. And other than that, I'm really excited to be here and be part of this panel. So thank you for having me.
Thank you. Congratulations.
Thank you.
Sarah, do you want to give us a quick introduction on yourself? Sarah Churchill.
Sure. Yeah. So my name is Sarah Churchill Llamas. I am a shareholder partner at Winstead PC, which is a law firm, a general business law firm. I'm the chair of the firm's healthcare and life sciences industry group. My background is really started, well, first I worked in genetics, then I went to started working in primary care. We started a health IT company, and I became the chief operating officer of that health IT company, helped it to grow to around 65 employees, where we were really focusing on how can we use information through a health information exchange to drive workflow in a primary care setting and keep patients out of the emergency room. And this was probably around 10 years ago. So we started early, even before you could, for these patients, and really tried to drive change. After that, I worked as a senior VP of strategic business development for a large clinical lab company. It's a global company, and really worked on, how do we bring value to our physician clients? How do we innovate in a changing healthcare landscape? And now at the firm, I really focus my practice on health information technology, telemedicine, and really helping my clients accelerate their growth. I have a corporate background. I'm fairly technical when it comes to data and transferring data and those things. So we really just try to tackle problems and help them innovate and not go to jail for fraud and abuse issues while we're doing it.
It's wonderful. John Friars is also with us. Please, I'd love to have you.
Sure. Thanks, Fabien, and thanks again for the invitation to join the discussion this morning. John Fryer, Vice President and Head of Market at Lumeris. background, actually started my career more on the health tech side. Spent a number of years at Cerner Corporation, as many of you know, is one of the largest electronic medical record companies in the world. Moved into management consulting, where I founded the Center for Healthcare Innovation at a large management consulting firm, doing advisory work with hospitals and health systems really across the country on how do they think about innovation and bringing all these new entrants into their traditionally bureaucratic and challenging existing environment across their provider system. At Lumeris, we're a value-based care operator that works with health systems, payer organizations, and physicians as they think about shifting their business model away from the fee-for-service environment of today and into a more value-based style of reimbursement. And so look forward to the conversation today. I think it's really interesting and challenging times in the healthcare ecosystem today, but to me, that just means there's a lot of opportunity and a lot of opportunity for innovators and disruptors in the industry to kind of find their niche.
Absolutely agree with that. And Balint? You're muted.
Yeah, hello everybody. My name is Balint Bene. I'm the CEO of Bene Studio, and Bene Studio is a digital product consultancy. We have a special focus on health technology, and we deliver premium quality mobile and web applications, and we integrate complex systems both for global enterprises and for startups as well. And just recently was named as top 10 health tech companies by Startup Beats. So we would like to be really active in the health space with knowledge sharing. This is why we are organizing this conference series as well. And I believe that nowadays it's more important than ever to share the knowledge with each other and to help with our experiences. So I'm really happy being here with everybody.
Thank you, Benny. It's really amazing to be here, and I think that's couldn't have such a most amazing panel to have such a different angle to talk about that incredible time we're in at the moment. So let's jump in. I thought it would be interesting, as we have a lot of startup CEOs and startup also sometimes listening, that kind of panel. They really try to understand where the future of healthcare is going. Let's spend a bit of time to look at trends. And I'll start with Laura. If you can give us a little bit of your thinking of what you're seeing from a provider standpoint, and how can they really engage with startup today? It's been known to be very complicated in the time, very long sales cycle in the past that has really impacted their relationship historically. But so what is going on now, and how can there's a new future being created with that relationship?
Sure. So what I'm seeing on the provider side, based on the work that I'm doing, is number one, that margin pressure continues to be a big concern for health systems. So, you know, payers are constantly changing what they're going to reimburse for. They're always doing that. But, you know, health systems are looking right now and trying to understand what the value is of telehealth. They realize the reimbursement may not be may not be there, may not be the money-making area, but they're looking to understand, so how can we use telehealth to save us money in other areas? Like, can we prevent readmissions? How can we improve health outcomes? How can we improve patient satisfaction? So I think, you know, based on that, the fact that the margin is very important. It's going to be more important for startups and non-traditional providers to really help the health systems to understand the value of some of these new products that are coming along the way, and the value of telemedicine. The other thing that I'm seeing is that the realization that healthcare is no longer a brick and mortar model. So, you know, patients are accustomed now of getting virtual care. They're going to expect that that's going to have to continue. And so what we saw, you know, with back in March, we saw a lot of organizations quickly implement telehealth, using FaceTime, Zoom, you know, different platforms. And now that they're kind of reached a little bit of stabilization, what we're seeing is that they're thinking about what's the long-term strategy for telemedicine. You know, how do we incorporate more modalities to provide patient care? Can we provide, you know, questionnaires? How do we do more asynchronous, synchronous technologies? How can we incorporate remote patient monitoring? All of those things are on their mind right now, with making it more of a holistic approach to telemedicine rather than this patch to address, the pandemic that was happening. And then lastly, going with that, there's the realization that yes, it's no longer a traditional brick and mortar space, but we're still going to need to have, in-person care. So they're looking at, how do they redesign their in-office operations? How is that going to look? How do we make things paperless and contactless? And in terms of, your schedule, how do you balance those in-person visits with those telemedicine visits? And what's the optimal mix? That's a question I get asked a lot. What's the optimal mix? What should we be doing? And alongside that is, looking at the staffing models, the way that physicians, nurses, everybody involved in healthcare is going to be doing this in the future. They're going to have to be retrained and really think about, okay, if I'm doing in-person care, this is what it looks like. And if it's virtual, this is what it looks like. So there's just a lot going on in the provider space right now. And I think, to this community, it's going to be helpful more than ever to be able to support health systems and providers to be able to navigate these new waters that we're heading into and help them do that efficiently.
Yeah, totally can see that. And that's a really interesting segue from John on the other side, because how much, I think Lumeris has raised, $800 million, an incredible amount of funding to exactly achieve that kind of transformation. Can you talk about what you're seeing from your side? I think that's really interesting.
Yeah, I think we're definitely in a very interesting period of kind of healthcare delivery. And I think in particular, when you think about the digital impact, in my opinion, we saw 5 years of digital adoption in a 2-month period of time. And what it demonstrated to me was really the classic laggards across the ecosystem who had held out on digital had to rapidly adopt different types of technology platforms and not only select their technology vendors, but figure out the protocols, figure out the workflows, figure out the staffing in such a rapid period of time. It was really interesting to watch, but it also demonstrated the clear advantage of organizations who had taken digital first strategy 5 years ago. And they really jumped out ahead and likely captured more interactions than some of their competing systems potentially, who are really chasing their tail trying to figure out how to deploy at such a rapid pace to really reflect the current environment that folks weren't coming into the hospital and weren't being able to go to their doctor's office, even regulatory being banned from going into their doctor's office. So how do you find that channel to be able to interact with them? I think the other thing that I've really seen is the impact of COVID has been felt very differently by geographic region. And so if you take New York City as kind of the first epicenter, who almost immediately their health systems were over capacity and overflowing with COVID volumes and ICUs full. And while that happened, basically the rest of the country moved to prevent that. And so they shut down elective procedures, shut down physician office visits. But many of the folks I was working with, they were seeing 1 or 2 cases of COVID, and at the same time, their revenues were down 50%. Many of them didn't address early enough the questions with their labor force. Those that did and moved to furlough employees earlier on actually weathered the early days of the pandemic better from a financial perspective. But now you're seeing that shift, and now the southeast part of the country and Florida and Texas are being hit harder. And they're facing kind of that similar surge that New York City saw. But again, the impact has been, very geographically relevant. I think the last and kind of important trend for this group to understand is, and take away from this is, overall, my opinion is that the dollars that are in the healthcare marketplace in aggregate are not growing. And to Laura's point about rate pressure from the payers, I think the reality from the provider space is that they're going to have to do more with less moving forward. And whether that's staffing or whether that's, financial dollars from commercial payers because, folks are now unemployed and have moved on to Medicaid or are uninsured. So as you think about it from an innovator perspective and a disruptor perspective, is the value proposition has to be crystal clear. And when you're going in and trying to talk with these provider organizations, you have to very quickly move to how this is meaningful to me today. And when I think about ROI, it's not necessarily just a financial ROI. I mean, there's quality ROIs, there's physician engagement, cost reduction, but you've got to move very quickly in your messaging to whoever it may be you're speaking to as to why you matter to them now, because they're inundated with folks trying to talk to them about the latest and greatest solution that's going to solve all of their problems. And many times they're discarding potentially viable options because they just don't understand the immediate ROI fast enough.
Yeah, and you were saying last time when we were preparing that conversation, John, about the fact that if you're not really bringing innovation on the forefront of your strategy today, you really are going to be impacted even greatly. And so I think that that discussion between what Laura was talking about, the trends about innovation, the collaboration happening so fast, and the mindset also have to change is really, I think, in such a short amount of time, fascinating.
I think that's right. I think the other thing I would add is to your point is, innovation 5 years ago, when I stood up the Center for Healthcare Innovation, it was traditionally a silo. It was a vertical within, a healthcare delivery system. Whereas now I see it as innovation has to span the entire enterprise. And I think rapidly we've seen over the last 5 months that start to happen, but continuing to break down those traditional silos and quit viewing innovation as its kind of own standalone thing as a part of the health system, and how really it integrates across the enterprise, is going to be fundamental to these organizations' success moving forward.
Yeah, so I can see that. I mean, it's like almost the most conservative industry ever to have to change the fastest possible time, isn't it? Which is really interesting. And so Sarah, from your standpoint of being a CEO of a biotech, being a startup size, now being a lawyer that understands really all different aspects of it, from the legal to, of course, like clinical and technological aspects of it, I think it would be really interesting to have your viewpoint on what you're saying from your side of the equation.
Yeah, sure. So I'll try to keep it really high level because I know we're going to go into more details later. And really from my side, I'm looking at it from the private equity side. Where are we seeing companies really starting to ramp up, right? So a lot of my large provider clients are, I think it's really what John said and Laura, everybody's struggling to figure out how do we survive? What does this look like? How do we deal with the margins that we're working in? But I think what is interesting about where I'm at now is I'm able to see where private equity is looking, where they're putting money, and who is really growing, because they're the ones that are coming to me not with a crisis, but with a raise, or they're trying to expand their services, or maybe they were going to sell off their telehealth arm and now they're not. They're going to try to triple it, because now all of a sudden everybody wants to use it. So obviously I've seen a lot of movement in the telehealth space. Those that are working in the staffing space, so sort of on demand, being able to ramp up and ramp down some of your telehealth staffing, obviously those companies are doing very well, and there's a lot of interest in the market in them. I've seen a lot in the drug development space. So sometimes it's workflow solutions that we're seeing on the drug development side. We've seen some new antivirals, that are working to come onto the market, and startups are getting a lot of funding to back that. And then employer health is kind of the other side of this. So around benefits and employers and even, if you're thinking of like a construction company, and they have to do health checks every day, what does it look like? What issues are they dealing with, kind of on that alternate healthcare side?
Yeah, I totally see that, especially like some companies now are not even going back to the office for another year. I mean, so that's a lot of implication on that front. And Balint, you're working every day with startups and that are trying to really bring the other side, or trying to really get into those providers and bring innovation solution into healthcare. What are you saying from what they're telling you?
Yes, nowadays everything is happening really fast and changing really fast. But if we step back and we try to see the trend, then we can see that COVID just accelerates the main trends. So on the provider and hospital and traditional health enterprise side, what we can see is a big pressure because patient behavior is changing. Patients are more proactive, more conscious, which means they would like to be at the point of care. They would like to control, own, and understand all the data and what's happening during treatment, and they would like to focus on prevention as well, especially nowadays when we are facing this virus situation. It's more obvious for the people that we are responsible for ourselves. So all this proactive attitude gives them a need. And the traditional players have to solve this need because, on the other hand, big tech companies like Google, Amazon, or Microsoft, Apple, they entered into this space. So we can see a bigger competition, and also there is a workforce situation, a lack of doctors and health workers. So it's not that easy to provide a higher and higher quality, better and better user experience in this environment. So what we also can see is the availability of advanced technologies like VR, AR, voice control, or IoT. And also the trend of interoperability. So people and providers try to manage the data transfer, and these technological possibilities could help to the traditional players as well. And as a consultant, I can see that our role is huge in this transformation. So we can help a lot to bigger traditional companies to improve their processes, to integrate with new up-to-date solutions from startups, from bigger enterprises, or to put together new, better workflows and better user experiences. So this is what I can see as a trend. And nowadays, COVID is a really big accelerator of these changes.
Yeah, so that's a really interesting situation, isn't it? You have a fixed market with the shortage of revenues and reducing margin, shortage of staff, and at the same time, a need for innovation, while it's been pretty much like still or harder to do for a very long time. So that's the district we're facing, and of course, a lot of ethical and legal questions attached to it. So let's dive in and let's take a question from the panel that I think will really be interesting, because there's not a fixed answer on that. And I was very excited to have your perspective. So if you were to think about what a hospital will be in 10 years, we see telehealth happening, we see IoTs, we see like a lot of changes, of course, about contacts. So if you were to think about what a hospital will be, what its role will be, how it's going to look like, I think in 10 years it's probably very different than today. And so it's really interesting to have your perspective about it, and I'd love to have your side of it. And I'll start with John, because you're seeing it from your standpoint about really being able to try to make those transformations every day.
Yeah, I think it's a great question, and something that I think a lot about. And I think it really depends on how the leaders of our hospitals and health systems respond to kind of the clear signs that do exist in the market today. And like Balint said, I mean, a lot of these trends already existed pre-COVID, but were only accelerated and brought to the forefront, by it. And I think organizations that proactively rethink how they interact with their consumers, who that's really what they are. They are consumers. They are their patients as well, but they are a consumer of the product that is provided by healthcare systems or physicians. How do they interact with them, and how are they able to fundamentally shift their business model to be able to invest their capital in the right mix, like Laura mentioned, of digital versus fixed assets? And how do they, think about that to remain in kind of the position I would say they're in today is they're in the driver's seat of controlling care and care delivery today, but that is fundamentally shifting. And if they don't rethink their business model, they will be left behind and someone new will be in that driver's seat. I think like Laura mentioned, you're always going to have some level of, face-to-face care, and you always need some provider that's able to respond to an emergent situation, a car wreck, a heart attack, a stroke. But if hospitals don't rethink fundamentally their I can do it all mentality and figure out how to engage with consumers differently, in my mind, they become a box with four walls and nurses inside. And they are a price taker. They are, left with whatever they can get from the other participants in the equation who are actually driving it. And if you think about, a lot of the activity in the funding in the startup space that's very focused on, condition-based medicine. And so the folks that are going after kidney care and the folks that are going after diabetes, I can only see that accelerating to the point where, they could potentially control much more of the equation into the future if the hospitals and the health systems don't radically shift how they think about, their marketplace moving forward.
That's super, very interesting, John. So you're thinking that in some ways they have to become almost specialists in some sense and don't be generalists as much as they were in the past, isn't it?
I think that's right. And I think it's identifying who the partners you may need in the equation are to be able to play in. If you still want to play, horizontally in all the various venues, I think you're going to have partnerships to be able to deliver that type of model effectively. And that's one way that these traditional, stakeholders can advance their model is looking outside their walls today and thinking about, who are our core partners? How do we move forward? Because a partner can help us move faster. It's often how I think about it.
And they can talk to each other. So that's a good segue for Laura, in a sense, if they will become specialists, and maybe that's not your viewpoint on it. So I'd love to have your take on that question and make it a very interesting and interactive conversation. Are they going to become specialists in your mind? Are they going to keep doing us? And how going to really engage to create a new way to be constructed and created 10 years from now?
And so we're talking about specialists in physician workforce or just
or the role of the hospital becoming more like specialized in some ways.
Okay.
Of journalists.
Thanks for clarifying that. Yeah, I definitely agree with that. John, you made some good points about consumerism really being the focal point of being able to compete. And to your point about the hospitals having more of a narrow role, I agree with that. We're already seeing that construction and capital has been moving away significantly from acute hospitals into ambulatory surgery centers and multi-specialty facilities. So from the perspective of patient centricity, I think our spaces are going to need to be patient friendly. They're going to need to reduce stress, reduce the effort for the patient, and really support healing. And I think a lot of that healing is going to happen in the home. So a lot of the care that's currently at the hospital, I think, is going to shift to the home. I think ambulatory spaces are still going to be around, but they're going to be much smaller. And I think these spaces are going to be able to have to convert to support different types of care on different days, because the focus isn't going to be on these facilities. It's going to be on staying out of the facilities and staying healthy and getting all that care in the home. And I think, yes, with the hospitals, we're still going to need that, but it's going to be for very highly specialized care, as you were saying. So procedural, interventional, complex intensive care. But I think these spaces too are going to have to be adaptable in their design. With the partnerships, I agree with that. We're going to need partnerships, not just in the hospital, not just in the ambulatory space, but partnerships in the community. We're going to see, in the health system of the future, people getting care at homeless shelters, at food banks, at senior centers, in the house, retail. We have that now, but all of these, it's going to be more about how can we get care in the places that people live in, work in, spend their time in, have fun in, and also how can all these, community players make sure that you're taking care of people's social determinants of health, right? Nutrition, you know, that people have a house over their head. All those things are going to be really important in the future in terms of, you know, where is healthcare going to take place.
And so that's really, so it's transitioned to two really main train here, and it's like the human-centered design approach almost of healthcare, and a specialized approach that be less inside the wall of a hospital, but more connected to the home. And so then there's a lot of notion of like data and question around how you can deal with those patients. And from a maybe ethical or legal standpoint, maybe start what you're thinking will be the hospital of the future, and how do you think it's going to all, because you don't have the confine of the hospital walls anymore, isn't it, for those conversations?
Right, exactly. And you're mentioning, you know, the data, right? That's going to be very important. And I know we're going to talk about data later on in this panel, but you know, if we don't have the data to support how much we're spending, if we're providing value, I mean, none of this is going to work. That's going to be very crucial for us to have, you know, advanced analytics. I think artificial intelligence and even blockchain technologies are going to be very important for making all this very seamless and coordinated.
I'll totally see that. Sarah?
Yeah, so, you know, I mean, this is obviously something that's so hard to predict. I mean, obviously there is going to be acute care, just like John said. I mean, it is a great question. If I'm just going to be like, you know, tell you, here's exactly what I think it's going to look like, and I had to guess, and, you know, I mean, I'm going to say, I think we're going to see more of a hub and spoke model. I think we're going to continue to see a lot of pressure on rural hospitals and smaller hospitals. And I think some of the larger hospital institutions are going to have to really step up and have command centers and be able to do virtual ICUs for, you know, basically for different outreach locations. And so I think that we're going to definitely see, you know, the hospital of the future is going to be, you know, when you take away the emergency room and, you know, some of the other acute care and things like that have to be there in person. I do think you're going to see more remote health monitoring, whether that's, you know, device monitoring or, you know, kind of consumer focused health monitoring. But the only thing that I see that someone else hasn't already said, because John and Laura's answers were excellent, is really, I think we're going to see a lot of pressure on smaller hospitals. And I think we're going to have to see some of the larger institutions really innovate to try to figure out how can they utilize virtual platforms to help support. I mean, you know, and I'm from Texas, right? So, I mean, I see these rural communities and I see these rural hospitals, but I think the same problem in urban areas really exists, you know, especially when you're looking at the and underinsured in the United States. I think they are really going to have to step up, and I think we're going to see complexes or buildings that are as big as hospitals are today, but they are all people supporting virtual monitoring and virtual care in remote locations. I think a lot of people think of telehealth as just the teledoc model where, hey, I can go see my PCP. And I think what a lot of people don't realize is that hospitals are really having to innovate on how can we provide hospital services, you know, so if you think of a NICU, I mean, it's hard for people to think about that, but when you can monitor these devices from anywhere and you have cameras, and now people are looking at, hey, you know, we have artificial intelligence that can tell me that this person's been laying on one side of the bed for too long, you know, and they need to be turned, or, you know, so I do think, you know, some of the larger hospitals are going to get larger and the smaller hospitals are going to get smaller, for good or bad. That's kind of what I see in the future. And I think we're going to continue to see more vertical integration for the payers. I think payers are going to continue to, you know, they don't want to be obsolete, right? I mean, it's like, we have two options. Either payers are seen as third-party intermediaries that don't add a lot of value to our system, or they're going to become the system. And so what we've seen is this march of the payers becoming the healthcare providers, and they obviously have a lot of incentive to do that. You know, whether it's to make more money or to not become obsolete. I think they've seen that in the stars, and they're really working on vertical integrations. From a legal standpoint, they're easier. They're not challenged as much as horizontal integrations. We've seen some very messy, expensive potential mergers of payers that have not gone well. And you've seen them pivot into more vertical integration. And so I think at the end of the day, I'm not quite sure where some of these large hospital institutions, how they're going to interact with the payers. I mean, are the payers going to start buying into, you know, these larger hospitals? I don't know. I would love to hear what other people think about that. I don't know, but that's kind of where I see.
My perspective is that you're exactly right. I'm glad you brought the payer piece of the equation up. The payer is the biggest threat to the hospital of today. And, you know, one corporate strategy that I spend a lot of time thinking and talking about is one that United Healthcare deployed basically under wraps, and it was basically hidden and received no press coverage until, call it 2 years ago. But United Healthcare building out their Optum arm, which is now one of the largest employers of physicians, owns the second largest provider of ambulatory surgery centers, owns the labs, owns the PBMs, and then has a payer relationship. Their goal is to commoditize health systems. And they're moving to take, you know, a marketplace, and it's called what I call capitated, where they put all the revenue and the risk down to the actual physician practices and the providers, and they make the acute delivery system price takers on who's going to offer me the best rate for this particular service. That's the Optum model, and you've seen every big, large payer move into employing their own physicians and growing their large physician practices. You know, that's a huge trend that's accelerated over the last 3 years, and is only going to continue into the future.
Yeah, agreed.
So that's really fascinating. Consolidation from the payers to the providing care, specialization, but also now you have, of course, the virtualization of care as well, isn't it? Which is really going into that mix of, you don't have localization apart from the ambulatory aspect of it. And so, Balint, what do you think started in playing, connecting those pieces together, isn't it? Because there's a lot of digital that comes in now to really enable all of that system to work together.
Yeah, I totally agree with Sarah, Laura, and John, and I just would like to add a few more perspectives. So in 10 years, there will be a lot of tools, devices, services out there, and people will be overwhelmed with that. So I think that there will be more important to have a guidance and have a quality assurance, and not just the quality of a specific treatment, but the quality health management. So to have people to manage the health data and to choose the right tools and processes on the right way. So hospitals can help in this holistic health management to help people not to lost in this all options. And another interesting role can be the cooperation between different experts globally, focusing on really special cases. So technology will have to reach that point when different doctors can work easily and on a daily basis on different cases, which we already can see nowadays, but it can be a major or a bigger trend. And also what I can see from the consultants' roles is that to have these hospitals to transform from a physical building into a remote first omni-channel provider who take care of the quality and the prevention as well of the patients and the security of the data of the patients. So more of a consultant for the patient. So for us, it's a constant work to have these institutes to transform and to adapt new technologies, but also to keep the quality, to take care of the security and the risks which could happen with the new things. And I have an interesting question. Like we can see nowadays movement against the really fast globalization. Maybe will we see a similar anti-digital movement in the future in that segments who are afraid of this really fast digitalization, habit changings, and the real risks of new solutions and the data privacy issues.
And I can totally see that, especially there's now like really like integration and like focus on the patient as a central design. You'll have prevention incentives, and you have to really a whole new set of how to take care of a patient along their life rather than only when they're sick, which should also bring a whole set of really interesting points. That was really a great conversation. I think that's such a fascinating question that really nobody has the answer. So let's keep going. And I would like to discuss about this revolution that you all mentioned about really telemedicine and telehealth. And so Laura, when we discussed, you made a really interesting point about the fact that now outside healthcare, there's a whole new set of capability we have. You get your prime delivery in sometimes the same day. You have all this kind of wearable IoTs that are coming to. So how far do you think can go beyond just a televisit as it is today to think about telehealth become expanded in the future? Laura, you're muted. And come to you yet.
Okay, there we go. Okay, so I think, telemedicine right now is such a popular topic because of COVID-19. It really accelerated the adoption of video visits for many. There was obviously some players that were already doing this as part of their normal operations, but we have to realize that telemedicine is not new. It's really been around for 40 years, but I think what's different now is that the focus has shifted really on the consumer side of the equation. And so what consumers want is a frictionless experience. They want, if you look at any other industry, they're trying to transform their services to make it seamless for their customers, for their consumers, to make it convenient. And, John was saying, healthcare is a laggard industry and they haven't been traditionally known to be innovative. So I think, telemedicine can transform one piece of how care is delivered. But I think for healthcare to really be transformed, it's going to really take additional components. So, I've been talking about the waste in our system, and I think, we have to focus on those things too. We have to focus on the things that happen before you get healthcare, things that happen after you get healthcare, eliminating the waste so that you're really maximizing patient care. And I think, once you're able to do that, that's when you're going to be able to transform healthcare. So what I mean by that is, you have to make healthcare seamless and coordinated. If we look at, patient cycle times is really a problem and a challenge that a lot of systems providers have. I mean, how many of us have gone to their doctor, showed up on time, and you're waiting 20, 30 minutes before they call you to the back, and then you're roomed, and then you're still waiting maybe an additional 15 minutes. Why? Because the provider was running behind, because they overbooked 4 patients and all 4 of them showed up. So if we had, predictive analytics, if we had some sort of way to figure this cycle time out, and I can show up, get seen, and be on my way, that's going to transform my life. Like, I think, same thing with being admitted to a hospital. If I get admitted, there should be a bed for me. I shouldn't be waiting in the ED for a bed. I think it's a big problem and a big challenge that many are working on right now. But I think, that's going to help transform healthcare. Along with that, I've talked about redundancies and efficiencies, and I think we need to eliminate paper and like collecting registration information from patients everywhere they go. Like we just need to collect that once and have a way for that to travel with the patient no matter where they go, so that you're not, showing up and filling out all this paperwork. So get rid of the paper, make it electronic, and not ask for it all the time. I think price transparency is going to be critical to also transforming healthcare. I think we're seeing a lot of the non-traditional payers being very transparent about what their services cost, and that's very attractive to consumers who right now, have loss of jobs, a loss of insurance because of the environment. And so, they're going to shop around for the best prices. And for example, me, I'm on a high deductible plan. If I need a surgery, you bet I'm going to shop around and look for the most competitive pricing. So I think that's going to be critical to making, healthcare transformative. And I think the last part is the interoperability piece. Without data, without, artificial intelligence and all that, we're not going to be able to do these things. So I think telemedicine on its own, yes, it's great, but we need all these other things for healthcare to really be transformed.
And how do you think about the CPT code in that environment, Laura? Because their billing is changing now, the type of billing you get on telehealth. So how can you have clear guidelines around that kind of questions?
I mean, that's part of it too, right? I mean, a lot of my clients are spending time reviewing the payer rules, and they're different for every payer. So that also has to be very streamlined. And so, the payers changing from a fee-for-service to more value-based care, I think that process is also going to have to be transformed to be more user-friendly and efficient.
And clear guidelines as well, for sure.
Mm-hmm.
And so,
Fabien, I'd like to take that CPT code discussion a little bit further, because I think it's a very hot topic right now. And so finally, with kind of COVID-19, we did see a movement to all the commercial payers and Medicare adopting actual mechanisms to fund the visit. So that was, a rapid shift that occurred very quickly in the U.S. healthcare ecosystem. I think the big question that remains out here, and this is somewhat of a provocative statement that I make with my health system partners, is the American Hospital Association and the lobbyists for my clients are pushing very hard that telehealth should be reimbursed at the same level as in-person care. And I look at it and I talk to my provider clients in a provocative fashion, and I say, why should it be reimbursed at the same level? In theory, you should be able to provide telemedicine and telehealth care at a much lower cost. You should be able to do it more efficiently, and we shouldn't bake in the inefficiencies of the past as we adopt the business model of the future. And that's a provocative topic, because you talk to a CFO and he looks at that and he says, well, if I see a 20% decline in my in-person visits and I replace it with 25% of telehealth, I still don't get to the same point. But my position is that's right, and you have to figure out how to adapt your business model to not bake in the inefficiencies of the past as care transforms into the future. So I think that's a hot topic right now in the provider space in this country, and something that's going to evolve, looking to the future.
Well, it's really hard for them too, because right now they're trying to make an investment in technology. Like they have to see that investment as a sunk cost, I think, before they can even move forward with what you're saying. And they haven't gotten there yet because they're still spending the money.
Yeah,
I think that's right. And I think, Sarah, the interesting thing that would be interesting for you to opine on is one thing that I'm seeing and hearing anecdotally is as this shift to telehealth occurred, I've heard from a couple of specialists where they have misdiagnosed or they have not caught things that they would have caught if it was an in-person visit. And the other, thing that's going to occur here in the near term is understanding what should remain on a virtual platform or what is effectively delivered via remote care or telehealth, and what does need to come in, and then what's the legal ramifications of what these specialists are telling me. Look, we've missed things, and we would have diagnosed this had I been able to see and touch that person, but I wasn't able to. And so how do you think about that from like a legal perspective? I think would be interesting.
Yeah, so I can, if it's okay, Fabien, is it okay? Okay,
Yes.
so kind of the nutshell answer on that, and I can tell you, you know, the way Texas looks at it, and a lot of other, I mean, a lot of states are moving in this direction, which is to say you as a physician are held to the same standard of care as if it were an in-person visit. And so a lot of doctors say, well, whoa, what does that mean? You know, when I talk to them. And the way that I try to explain it to them is if you're talking to this patient and there is something that you would do in person that you can't do, you have to really think about recommending that the patient go see a physician in person. Like, you don't have to feel obligated to come up with a diagnosis or no diagnosis. You know, if you don't have to prescribe, it's okay. And, you know, so, and I think it's actually another good reason why telemedicine visits maybe should be reimbursed at a lower rate, because there is going to be maybe 30% of all visits where you have to have a follow-up in person. And you still, I mean, the system still saves money overall, but yeah, that's what physicians are really needing to look at, because they are being held to the same standards. And I mean, it really comes down to their state medical boards. And that's why the state medical boards have said you have to be, you know, boarded basically in every single state where a patient that you're providing care to is located, because they want to be able to come after the doctors. You know, I mean, I think it's nice to say we're going to have a multi-state compact, but at the end of the day, you know, if I'm a Texas resident and I have some doctor who, you know, is not board certified or, you know, boarded in that state, and they do something wrong, you know, the medical board in Texas wants to be able to go after that doctor. And so that's why they're all holding on to that, even though it's a major barrier for this movement. And there are a lot of barriers to the movement. Yeah, so I don't know. Fabien, do you want me to just kind of roll into my what I was going to say about this, about the future of telemedicine?
Yeah, go ahead, please.
Okay, so the only point I was going to make, which is I think right now everybody is saying telemedicine is going to change the world, you know, and I really hope that that's true. But I think that there are some major regulatory and legal hurdles to that being true. And I think if we can't work through those, I think it's not going to be as fast as everybody hopes. And so even when you look at credentialing challenges, licensing challenges, like I just talked about, I think that it's just not easy, because every single state makes the rules. And so you are literally having to do 50 state surveys, and it's not, and it's not just as simple as saying, hey, I have a doctor who wants to practice in all, or, you know, I have a group of doctors that want to practice in all 50 states. You know, what should we be thinking about? You're actually looking at, hey, can my genetic counselor practice in all of those states? Can my you know, APNs practice in those states? What can my nurses do? What if my nurses feel like they're actually not providing nursing services, but they are licensed nurses, you know? So, I mean, those are the kinds of issues that we're having to tackle. And it is a messy web, honestly.
Yeah, and I totally see. I mean, in some ways, what is internet known for that is now penetrating healthcare is the notion of having quite free global distribution in a way, isn't it? But you have these kind of rules from the past, these states define. And so Balint, when you create a startup that has to offer a broad service to be able to make their revenues and margin, how do you account for that? How can you create telemedicine solution that bringing that expansion, but at the same time have all those old intricacies to deal with?
What I can see is there are different levels of telemedicine implementations. So the simplest one is the remote communication. So when the patient and the doctor can communicate on a real time or an asynchronous way. But I think this is just the first step, and interoperability would help a lot, and all the players could benefit from that. So a lot of startups could provide much better services if they could access to a better data profile of the patient. And after a specific treatment or measurement, if this data set is bigger and bigger, then the the traditional providers also could benefit from it. So, so when one doctor is checking the profile, it could help a lot to see different measurements from different sources, even from different companies. If we could reach that state, it would help a lot, primarily for the patients, because they would have even better services and a better understanding of their health. But it would be also good for the startups and for the larger providers as well. However, we can see that it's coded in many business models that the first step to open up the data is a really painful thing. So it's not that easy to do and to go that direction.
Yeah, no, that was really a fascinating conversation. So it's really incredible to have such panelists, and I think I could probe you for another week if I could, because I think there's so much value and knowledge around the table here. Unfortunately, we're around almost close to be at time, and so I want to make sure that last 4 or 5 minutes, I always had this idea. I was preparing the panel saying, if you had to build a startup today, $1 billion idea or startup in healthcare, we'd love to have, if you can go quickly around the table and tell us what would that be, and where do you think there's a bigger opportunity for our startup audience? And I'll start with Balint.
Oh, yeah, it's a really exciting thing. And I believe that the most important actors for health technology and telehealth are the doctors and the healthcare workers. So my startup idea would have them helping doctors and health workers in a constant medical training and adaptation, because it could eliminate a huge bottleneck and it make health providers, vendors, and startups, and even researchers even more successful as well. So what we have to see is that the biggest problem for doctors is they are extremely overloaded, and they have a lack of training. So they can't adapt the new technologies and the new methodologies as well. So despite there are a lot of innovation out there, if the doctors are not able to implement that innovations, then it's worthless. So my startup would focus on this constant medical training and adaptation.
What about you, Sarah? What are you thinking?
Yeah, so I think I would be focusing on real-time direct-to-consumer lab testing, honestly.
That's great. John, what about you?
I think I would be focused on data liquidity, and with the ONC's latest rule that's going to allow a totally new level of data sharing. If you think about what Plaid did in the financial services space, you know, if you had told me 10 years ago, I'd be okay with some organization I had never really heard of pulling all my information together and being the piping for all these other companies that have developed like a Wealthfront, you know, that's $1 billion business easily. Plaid, you know, just this year was acquired by Visa for $5.3 billion in the financial services space. I think that's a huge opportunity to be that piping in the healthcare space.
Yeah, and unfortunately, we don't have enough time to go into this data blocking rule that came from the ONC in March. It's a real topic I wanted to make sure we covered, but so please make sure you're looking at that. That's really fascinating change in the industry. And Laura, what is your viewpoint on that?
So I'm going to keep it quick, but my idea was really a combination of like Redfin and Meets Yelp for touring maternity spaces, labor and delivery units. So this came to me because I noticed that a lot of hospitals closed down their maternity tours because of COVID. And some of them were like, we're doing live tours, you know, Tuesday nights at 7 p.m. But then others were like, nope, we're completely closed. So I just thought, you know, Redfin had this increased interest in their virtual tours. You know, why couldn't we do that for hospitals? And then branch that have like Yelp reviews around the hospital and how the experience was. And then you could branch that out to other things. Like I could hire a doula, I could hire, you know, make an appointment with the delivery team. So that was my idea. But then yesterday I saw that they're projecting that people are having less babies, and I think they're saying that 500,000 less children will be born next year because of the pandemic. So maybe not a $1 billion idea, but that was my idea.
Yeah, that was really an amazing conversation, amazing panel. Unfortunately, we're out of time. I think I have like 20,000 more questions to ask all of you. So really, thank you for your time. That was just an amazing panel. I think we all learned a lot about where it's going and questions to really start tackling and working together, because it can't happen if we don't work together. I want to thank all our panelists and Bene Studio, and I also want to make sure that there's the Wova platform if you want to network as well. It is a place to do so. And so thank you so much. And if you have any questions, feel free to reach out to all our panelists on the different expertise that they can provide. And so they will be very happy to work with you.